What's up? What's up, everybody? Aloha Thursday. Yeah, special night tonight, Thursday night. I hope you guys all having a great week. Um, yeah, hope you guys having a great week. Tonight we got Malama Pono Health Services Kauai. They're going to be joining us tonight to talk about fentanyl and the crisis that we're in. You know, I've been getting a lot of calls. It's out there, right? Everybody knows fentanyl is a very dangerous drug, wiping out a bunch of our kids, adults. Like all other drugs, it doesn't discriminate. And again, the whole basis of this show is to inform and educate. I hope you guys get some good information tonight. I got to say, last night I went to the Holomua 3030 briefing at Wilcox School cafeteria. For those of you that don't know, the state of Hawaii, the Division of Aquatic Resources, have introduced this they're calling it Holomua 3030, and what it is they want to manage our fishing resources, our ocean resources. And the 3030 means they want to manage at least 30% of our coastlines, which would impact our fishermen, our local fishermen. And I went to the briefing last night and I actually spoke. I asked them, how do you come up with 30%? Uh, right now, on our island of Kauai, 51% of our coastline is not accessible, either because of, the Napali coast, or areas that are PMRF and other large landowners have basically taken away access. So 51% of our island already is, our fishermen cannot get to. If you include Niihau, which is part of our county, that percentage goes up to 61%. So the state, in their infinite wisdom, wants to just blanket 30% at least minimum. So you, not 29, not 28, but 30% of our coastline they want to put into their little management inventory, which would deprive our local people. And I don't know how they're going to do this with the Kanaka, with the people that have constitutional gathering rights. I'm not sure how. I asked the three gentlemen from the state last night, how did you come up with 30%? I mean, how do you blanket 30% across the state? And he obviously couldn't answer. He said research says that's a good number. I don't buy that. I said I want to see the research, but it's pathetic. It's crazy, really. Our island here on Kauai. I spoke to a lot of fishermen. The place was packed last night. Wilcox cafeteria. I mean, probably 400 people total, inside and out. No one seems to think we have a resource issue. The fishermen are really good at managing themselves. Yeah, we got some people out there that take more than they need, but they manage themselves. So here comes the state again, trying to dictate what we can and cannot do, and I'm frustrated. The good news is Mayor Kawakami, Representative Tokioka, myself, council members DeCosta and Cowden all went up and testified against this program. It's crazy. And I bring that up tonight because it's frustrating and I needed to vent for a little bit. So we'll definitely be having a show on that coming up soon, hopefully within the next week, because I think the public needs to understand what this state is trying to do. The other thing I saw on the news tonight, which was quite disturbing, was the number. AARP did a study on the number of our kupuna that are homeless here in our state, and interviewed a 73-year-old woman on Oahu, living right outside of the capital. And I start to think about how messed up we are in this state. We're gonna put all these campaign promises. Uh, we got to hold our politicians to the promises that they make. It's to me, it's just not acceptable to see our kupuna living on the street. How can anybody think that that's okay? When we hear about the billions of dollars being poured into entertainment projects, stadiums, entertainment districts, all of these things that are nice things to have, but I mean, all those legislators, you cannot tell me based on what I saw on the news report, where that woman, I've been to that Capitol building many times. I cannot see how the legislators that go to work every day cannot pass her. And how can they think that it's okay? So I mean, it's frustrating, and it's hurtful. There's a lot of things. I was just telling my wife, man, this state is going downhill so quick, and again, all the promises and affordable housing and all of these things, and I was actually shocked. I know that we have an issue here in Kauai, and not all homeless people are drug addicts and thieves and crooks. And I've been pounding that drum for a long time, and we really got to start taking care of our kupuna and our keiki. I got to tell you, man, it's how difficult can it be to create senior housing for our homeless kupuna? Give them a roof over their head. Um, it's not a money problem. I don't want to hear that we don't have the money. Please, please, please. Um, it's a priority issue, and I hope all of these people that voted for our governor hold his feet to the fire, because that's where it has to start, at our state leadership. And Yeah, Bert, a 77-year-old lady said her rent was increased from 2,500 to 3,500. She's going to be homeless. I'm hearing that story so much, uh, and something just has to be done. I mean, that's just something that you bring the legislators together, you bring the county council, the mayors, and come up with a solution. And it really is funding. Uh, Maybe we got to forget about the wants for a little bit and focus on the needs, and that is one of the, I tell you, in my opinion, the most pressing needs. So anyway, I again, that was my time to vent, because I need to vent too, and I appreciate you guys listening to that. But yeah, it was kind of disturbing to see that on the news. So anyway, back to the show tonight. Malama Pono Health Services Kauai. We have CEO Misty Bailey Myrick, and Associate Director, yes, Associate Director Charles Ressler, who happens to be the son of a very, very dear friend who is no longer with us, but I love that man to the core. And let's bring him in. Aloha. Can you
Hello.
guys hear us?
Yes, can you hear us?
Oh, yes, we can hear you. We can see you.
Yay. Thought this would be easier.
Well, it
Thank you.
is. It is.
Thank you
Yeah.
so much for saying that about my father. I appreciate it.
Oh, man, I got to tell you, he taught me a lot. The guy was just in life, you come across people who just different. They're special. They're genuine. Um, and he was that. He was exactly that. And yeah, I loved him a lot, and it was sorely missed. And I'm glad that you have stepped into his shoes to serve our community, and we appreciate you guys being with us tonight. As I said earlier, tonight we will be talking about fentanyl. We're talking about what the first thing I'm going to turn it over to you folks to share with our viewers across the state. Who is Malama Pono? Malama Pono, I think a lot of people look at Malama Pono as the place that takes care of people with AIDS. Um, that's the stigma, or I don't know,
Yep.
that's just what Malama Pono was known for so long. But my God, in the last couple of years, since I got to meet Misty, there's just so much more to Malama Pono. So I'm going to turn it over to you guys. Please feel free to introduce yourselves and share with us a little bit about Malama Pono.
Oh, we do so much that oftentimes we are required to bounce off of each other because it can be easy to forget. Um, I'm Misty Baymark. I am the CEO and president of Malama Pono, and I've been here since 2012. You have been here for 9,000 years too.
Yeah, this is actually my second stint. I started this one's 2018 till now, and before that, I was the prevention director for about 3 years, from 2012 to 2015.
Yeah. So we both are healthcare background, social work background, and Malama Pono is definitely known for taking care of folks with HIV, AIDS. We just refer to it as HIV. We do hepatitis C testing, hepatitis B testing, STD testing. We have a women's wellness clinic where we do pap smears, free birth control. We can assist with payment for breast screenings, mammograms, and the other procedures related to that. We have
The tobacco cessation program. We also do Medicaid enrollment. We just started that to help people get connected to healthcare, healthcare insurance. Um, and then we do HIV case management. So anyone who's living with HIV, we try to help them get the resources they need, just like anyone else.
we do Hep C case management. So if someone is diagnosed with hepatitis C, we're able to talk them through their 3 months of treatment and work with them on that. We do a plethora of things. We have a mobile medical clinic that we take all these things on the road and we go all over the place. We have a satellite location in Waimea at the neighborhood center. We're at the old Department of Health office and we are out there once a month, probably going to increase that. We're in Kapa'a every other week, I think on Wednesdays, but don't quote me on it. Go to our website or Facebook to check it out and see. And we also do a needle exchange program, and Narcan, which is why we're here tonight.
Awesome. Thanks for that. And I hope our viewers are. I know they didn't have enough time to write all of it down. So I believe is it malamapono.org? Is that the website?
It's mphskauai.org.
Okay. Yeah. Got it. Okay.
Has to be confusing, right?
It gotta be difficult. Yeah. MPHS
Kauai.
Hawaii.org.
Yep.
Okay. So I'll go check it out. We'll put it up later for those of you that are interested. I highly recommend you checking the website. And these people are good people, great organization. And, I really, like I said, I really got to know Misty probably, 5 years ago now, 6 years ago.
Yeah, probably six years ago. Yeah.
Yeah.
And banging on your office door.
I remember sitting in my office and just learning about Malama Pono and just thinking, wow, I did not realize that you did so much. And it's expanded even more since then. So
Yeah.
thank you. Tonight, we wanted to share with our viewers what's going on with fentanyl, what's going on with the drugs that have really invaded our communities across the country, really. Our focus right now tonight is really in Hawaii and Kauai especially. And we hear the horror stories. What's weird is we're not hearing. I don't think we're hearing enough about the dangers of fentanyl. I don't think we're hearing enough. I hate to say promotion or campaigns for educating our the general public. We hear those stories. We hear the people when they get arrested with fentanyl. We hear about people that maybe are dying from fentanyl, but not enough education on what the heck this really is and how we can combat this and take care of the people that we love. And it's not limited to age. It's not something that's just hurting our kids, but it's hurting our adults. So I'm not sure how you guys want to do this, but maybe just start with fentanyl and what the heck this thing is.
Oh. So I think one of the reasons, this is just from what we see, and Charles will add in where I know he will, what I miss out on. But I think one of the reasons that it's not talked about as much, Mel, is because drug abuse is stigmatized so much that people don't want to talk very much about it. And having it as a diagnosis, because it is a medical diagnosis, right? It's not 1980 or even 1990 or early 2000s. We've come a long way, and harm reduction is a big part of what we use. It's called a harm reduction model, which we'll kind of expand on in a little bit. But that's what we use nowadays to kind of reach into that community and to help them. And that's something that we're working really hard to do. But I do think it's the stigma of it that does keep it kind of, quiet. And nobody wants to talk about, a family member that maybe, has a substance use problem. And we usually say this later, but I always say nobody wakes up on the last day of their senior year of high school and says, I can't wait to be a meth addict, right? Nobody does that. That's not real life. People don't wish for this to happen to them. And it is a real diagnosis. It's a medical diagnosis. So we always preface it with, that. And it's gotten more dangerous not because of availability. I think a lot of people think too that it's just because I say this every time, and I know Charles knows what I'm going to say. We do not demonize our physicians. We love our physicians. They do not overprescribe anything that has led to this immediate problem that we're seeing now. The fentanyl that we see right now is manufactured on the black market. It's not what you would go to the hospital and get. It's not, if someone had cancer, what you would get. This that's being mixed into some of the drugs that we see on the street, or even into marijuana, whether it's not medical marijuana, because that's a safe, there's a safe space to get that. But we definitely are seeing this brought into our islands.
Yeah.
We don't know.
We're getting a lot of questions about where is it coming from. Do we know where it's coming from?
Really, through all the research, it looks like it's coming from China. It seems like this fentanyl that's being illegally distributed is being taken from fentanyl patches that are given to cancer patients, and the liquid is being drawn out of it and then repurposed, and that's why they can turn it into, they can compound it, make it look like a regular pill. So some people don't even realize they're taking it. Let's say they don't have a prescription for Xanax and they're going on the street to go get Xanax, and they can compact it to make it look like a Xanax pill. So really, it seems like most of that is coming from China.
Yeah. And then they figure out what the chemical compound of it is. And I actually, we've done this so much now. We both are constantly looking into what's the latest and greatest and what's going on. And I've seen a couple of documentaries about, and very good documentaries, like they're not just random somebody throwing something together. I can list it later in the comments, but they talk to the chemists that work for an underground lab. They blacked their faces out, but a couple of them they didn't, but they talk about, that they make it. They can make whatever they want to. They can make synthetic anything. So they can make a synthetic Tylenol, or they can make a synthetic, it doesn't matter, an opiate of any kind, like a Percocet, whatever, or Xanax, or if it was a benzodiazepine. But it's scary how easy to duplicate it is. But wait, to kind of flip it back over, I think that we kind of went in an interesting direction, but not so positive direction whenever they started to crack down on physicians, because it's hard enough for them to do their jobs with, their stringent restrictions of a lot of commercial insurance and some of the policies they had to look at. Because then we had looked at people that were on chronic pain management, which is very real, and they got cut off from their very needed medication, so they started going to the street. And then next thing we know, we have people that are in their 70s and 80s addicted to heroin or meth because they couldn't get their medication anymore because the government came in and threw such strict rules on our physicians. And so that kind of was a big flip for us. So it's gone down this really weird cycle.
Yeah, and it's kind of become a cyclical problem, because now, because the fentanyl is so strong, those that are addicted to opiates, they seek out fentanyl. So, and drug dealers understand if they don't put fentanyl in their opiates, their heroin, then they're losing business. So, unfortunately, it's gotten to that point where people are craving it, people want it, and now dealers they're more open to putting it in their drugs because of it.
Fentanyl is a legitimate drug. I mean, it's been used by doctors over the years, but it's this new wave of this synthetic fentanyl that is being created by these chemists in labs, and this is what's coming to our shores now. And we're noticing now that it's getting worse and worse and worse. And how do we? And I know you guys. A lot of the things that you do, you cannot discuss. But generally speaking, how bad is the fentanyl problem here on Kauai?
I will say I think it's calmed down a little bit. We did go through a period where we were really busy. We don't just do so. The work that we do is based around something called the harm reduction model, which is we try to take the least harmful route for people, um, which is why we do needle exchange. So when people come in, we give them one clean needle for every dirty needle that they give to us. And that's hard for some people to think about, right? Because when I first came to do this work, it was hard for me too. But when you think about it, it's we're preventing somebody from getting a disease, them sharing needles. It's a long list of things. So when we exchange needles, it makes it less likely to pass around diseases. I don't know if right now I haven't heard of any major um,
So it's
issues.
hard for us to gauge in the sense that, like, if people are coming in for needle exchange and exchanging needles, that would seem like the most opportune time to talk to them about this. The hard part is there's still that stigma. They still walk into our clinic and
Scary.
really aren't sure about where we stand or what we do. So it's a process to really understand it. We did talk to KPD
Yep.
when we did the trainings there. Um, and it does seem like it's faded a little bit, but I did see on Hawaii News Now that I think in the month of September of this year there were 24 drug overdose. EMS was called to 24 drug overdoses alone. So in all the islands.
Yeah.
So that's some of the highest we've seen. I think it just ebbs and flows. It's who's bringing in the drugs and where they're coming from, really.
And we do it from a standpoint too, where we actually give out test strips to people that come in to exchange needles to test to see if the whatever their drug of choice is, and we do not judge them, um, that they can test for fentanyl. So that's people get a little quirky about it, right? They're like, why would you help them do drugs? Well, I would much rather them test for it and see if it does have fentanyl in it, because then we can also, the our local police can trace that backwards. So if we needed to, but we do not do that, by the way. We do not report anybody to the police. We do not. But if somebody were to tell us, hey, I had some fentanyl or some marijuana that had fentanyl in it, I guarantee you it would get back to KPD and they could look into it. And it not be blamed on a person, but just in general that we would know it was here, because it did happen earlier this year.
Let's talk about the stigma. Let's talk about you mentioned that some people get quirky about needle exchange. There was a time in my life I thought that was ridiculous. I'll be
I know.
honest. I just thought that was insane. You're like promoting drug abuse. And of course, as we get older, we get wiser, and as you speak to more people in the field, you start to understand the reasoning. But uh, drug addicts that use needles and share needles, they create a huge health problem, a huge health issue. When the story ran on one of the local news channels about organizations on Oahu handing out test strips for fentanyl, uh, I mean, it makes sense, right? You we're until we get these individuals into treatment and getting them on their way to sobriety, they're going to be using drugs, and we know that. So, explain the concept behind the needle exchange or even the fentanyl test strips. That it's really not promoting drug abuse. It's I like the harm reduction model, but maybe you can explain that a little bit for our viewers, because I'm sure there's a few viewers right now saying, "Oh my God, these people are
There
nuts."
are, I know, and we get it.
We do
We
get
get it. Like we totally understand because we've been there and we've had to wrap our heads around different ways of thinking. I think you do a really good job explaining.
Yeah, I think the main thing that we all want to understand is we're all trying to get to the same place. We want people to stop using drugs and to be abstinent. But along the way, we aren't going to get buy-in unless we make a relationship, because they are people too. Whatever caused them to be in that situation, we want to be able to meet them where they're at, give other services, be safe for themselves, and to the rest of the community, like you were saying. So, for instance, if someone's using heavy drugs, usually telling them don't use heavy drugs doesn't work.
No.
It just doesn't work. So what they do is they go out, and if they don't get a clean needle, they use an old needle, and then they can get an acute infection. They can die from that. They can also pass on HIV and HCV as their friends use it, including the spoons or the cooking utensils they use. Um, So it's just definitely trying to meet that person where they're at. And it's all along the spectrum from heavy use, from some who heavily use, some who are in maintenance mode, and some who are abstinent. And all these programs really get buy-in from previous users. So we understand what they were thinking when they were trying to quit, what their barriers are. And really throughout the world, this has been the most effective way to get people to quit using hard drugs and opiates in general. There are certain parts of the world where they actually have facilities with nurses. They give them the heroin and they inject it in front of the nurse. So they ensure that they're not getting infection, doing it wrong, getting tainted drugs. And that's the same concept with fentanyl strips. We want to give the strips so that someone who, of course, we don't want them to use methamphetamine or cocaine, but they're not there to use fentanyl. And fentanyl can kill them. So they can test their drug with the strip and make sure that they're not getting fentanyl in their system.
Fentanyl, the street fentanyl,
Yes.
is said to be, I don't know, 50 times stronger than heroin, and even more, depending on the strength that these chemists are putting into these pills. What does fentanyl actually? How do people die from fentanyl? What's the? We all saw the video of the officer in San Diego who got exposed to not ingesting it. He just got exposed to it and he collapsed. Uh, what does fentanyl do to create this problem, which could lead to death?
So it's a narcotic overdose, right? So it is a narcotic. What they do, what that, and I watch your show all the time, Mel. You know that. I will text him in the middle of the show a lot. But if you hear it buzz, it's usually me. But that was, and I, like I said, put this in the comments the other day. I think that situation was a carfen. It's called carfentanil, which is a lot different than the fentanyl we're seeing. Like that's
Yeah, it's used for elephants.
Yeah, it's an elephant tranquilizer, by the way. That should tell everybody all they need to know. It's a tranquilizer, and the dose and the amount in carfentanil would put an elephant down.
Right. And it's one of those things too where, like, if let's say you get a Tylenol from the store, you explain this better than I do.
Well, so if you get a prescription, say that you get Tylenol, right? You're going to go, you take your 2 Tylenol. If we take that Tylenol and we go cut it in half under a microscope, I can, or whoever can look at this Tylenol that's trained in it and say, oh, this is a 250 milligram, I'm making it up. It's 325 Tylenol, by the way. The 325 milligram Tylenol, because when I cut it in half of it, both halves equal to 325, right? And when they press and put fentanyl into, whether it's a Xanax or a candy, for example, because it's been found in candy-like things, and other medications. If you cut that in half, it's so like the distribution of it is insane. If you would get that kind of medication at the hospital, we know exactly how much per milliliter or per tablet is put in there. And when these people put this fentanyl, which is different, into whatever pill or drug they put it in, again, we've seen it be in marijuana here on island. It's a total different beast, and it's not equally put in like it would be if we cut up that Tylenol. We'd say, oh, look, it has this much filler and this much acetaminophen in it. This is like we cut the pill in half that they have, and it has a whole bunch of filler in one side and then a little bit of fentanyl here, or a little bit of the drug of choice that they were going to use. Say it was heroin. I mean, this is wrong scenario for heroin, but we're using it as an example. But then the whole other side of it was all fentanyl. So it was all throughout the pill. So if someone broke it in half, like if you broke in half any other medication that's scored, it should be equal, right, on both sides. But when they put this in, it's completely distributed wrong.
Another thing too is, like, I know we say chemists, right? Some of those drug dealers are definitely not chemists,
real chemists,
and they're doing like one full for however much heroin. So it's definitely not a science,
right,
as far as how they're putting in the drugs, and that's part of the problem.
These underground labs are anything but professional, right?
Yeah. That that's the thing. I mean, you know, nowadays dark web, YouTube, you can learn how to make anything you want, and that's the sorry thing. I read a case once. It was in the mainland, but it was a maid, a housekeeper from a hotel who, when she cleaned up the room, she found some cookies, and she thought it was, you know, like when you leave a hotel, some people leave tips, you know, like, you know, oftentimes we'll leave what we didn't use, chips
Yep.
or whatever. But anyway, these cookies were laced with marijuana. The problem was, like you just explained, in these homemade marijuana cookies, the the
Distribution.
the distribution of the THC is not all the same. So
Right.
one cookie may be completely loaded with some high potency THC, and the lady got sick and got really sick. And it was because the distribution of the drug was not the same, right? And it's kind of scary. And that's, I think, what the big problem is a lot of these people today that are getting affected and even killed with fentanyl, a lot of them don't even know it was even in there, and they're trying or using marijuana or cocaine or meth, and the dosage of the fentanyl in that drug is so significant that it kills them, and that's the scary thing about this drug.
It is very scary and unpredictable.
Mhm.
It's very, 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 very unpredictable. I mean, we've definitely lost people, here at home on Kuwait, and it's been a scary, I'll say, last year of us really starting to feel the hit of it locally here for us. Um, and
Yeah.
definitely seen an increase in people that want to test their drugs, And we were talking about this earlier today. There are countries that have legalized all drugs, by the way, if you want to look at a really big harm reduction point of view, right? Now, dude, we are not saying it's right for us, the US, or anything like that at all. But I think it's Portugal, right? That, excuse me, has legalized drugs, and they still have fines for if you look like you're going to be, and your intent is to sell it, but they allow people to have whatever their drug of choice is for personal use. And while it is controversial, we admit that it's a very controversial thing. We did see some significant decreases in overdoses, infections, their prison system, big drop in the amount of people that were being funneled in and out of their jail systems. And we're definitely not saying that's right for the US, but at all, we're not suggesting it. But it's not just them. It's with several, what's it, Uruguay.
Yeah, I mean it's really to one not allow drug dealers to make a ton of money, right? It cuts that supply stream. Two, it focuses on rehabilitation. So really helping people get off the drug and giving them the resources for it.
And destigmatize it.
Yeah, so it's just a different focus.
Yeah, and our state is so far behind in uh, whether it's substance abuse or mental health care. We just don't have adequate uh, supply of these facilities, and that's the difference. We're not able to treat these people. We're not able to provide them with the adequate care that is needed, and we know that, and we need to focus on that. Um,
Most
so
definitely.
yeah, I mean, there's nothing available. I mean, it's rare when we have an opportunity. I just attended the drug court graduation a few days ago, and we had three graduates, and these people came from very dark places, and because of the program, because of the treatment that they received, they have an opportunity now to start all over, and it works. Treatment works, and again,
Absolutely.
education works, and I think we really gotta start looking at providing and making this so accessible and taking the stigma away, taking the stigma out of it, and that, like you said, it is a disease that we gotta, like any other disease, we gotta make sure we have the adequate resources to treat it. So I guess Narcan. I'll talk a little bit about Narcan because that's now. I mean, I see now where people are able to get some free supply of Narcan, but the pandemic is still here. COVID is still around. Obviously, the impacts are slowly reducing, but the government gave everyone tests and masks and all these things. There's a period of time you could just these things were readily available. In fact, the Kauai still has free testing and free all of these things. But why aren't we providing? Well, we are. I shouldn't say we're not, because we are. But again, the information isn't getting down to everyone. I was surprised to hear from you the other night that you were providing Narcan. The state now, I can't remember. I put it up on my page, folks. If you guys are interested,
Triple
go to
HRC.
my, yeah, and you can sign up, and they'll send you two doses of Narcan to your home for free. But I don't know, if you ask me. I don't know how much those boxes cost, and I want to thank Malama Pono, because you all came to the police station and to the prosecutor's office. You provided the training, and you provided us with boxes of Narcan. But why aren't we doing the same? Why isn't our federal government flooding our schools and homes with Narcan, so we can hopefully prevent someone from dying if we're in that situation where someone is OD?
That's a good question. Let's start off with
We have the
that.
same question.
Um, yeah, I think, and I've heard this from people that we've given trainings to. I think some people, there's just so much stigma behind people who use drugs that they feel like it's not a good way to spend money. And that is the biggest thing I've heard, which I don't agree with at all. And I know Misty doesn't either. Like you said, this can save a life. This can give someone another chance. And this is not to say or assume that somebody didn't take that by mistake. We can't sit there and assume that this person's a heavy drug user and has been doing it for a while and is a criminal or whatever we want to assume in that sense. It could be someone who had a prescription and they're addicted to opiates. So they go on the street and they take a dosage that they think is okay, and it's not. So there's just a lot of
Or a police
scenarios.
officer.
Yeah, just a lot of scenarios.
Yeah, or a police officer at a traffic stop. Mel, like the video you showed, that's very real. That's a part of our training when we learned initially when we learned about this program and we decided to take it on for Kauai. That's what we learned about was police that dropped just from inhaling it, and that's what it does. Tranquilize to ask your question or answer your question from before, and basically just shuts down your ability to function and breathe on your own. When I listened to that police officer say later how he felt, like he was trying to take a breath and trying to take a breath, but he couldn't take a breath, and that's because everything's in timeout, and not in a euphoric drug kind of a way. Timeout, right? So like what we would think or we would assume that somebody would be trying to do, he literally took a whiff and it got into his lungs and he dropped. So, and this is what saved his life. Actually, the very kind we have is what they showed, on TV of them or on your video of them using. So it's very
Yeah, it,
important.
it was it was the exact same brand, so I know the one I have is good stuff. It works.
That's why I'm like, oh, I think this is the exact one they were using, as a matter of
It
fact.
sure looked like it. It sure looked like it. um, and he had to receive multiple doses. Now he described it as his lungs had just locked up.
Yep.
And I know you were saying that kind of was like the elephant tranquilizer version of this thing, but is that similar to what the street Narcan that I mean not street fentanyl that we're seeing here in Hawaii? Is that the same thing that happens to them, where
Any
the
opiate
lungs just
overdose,
lock up?
yeah, any opiate overdose is going to feel like that. So whether you've taken a ton of heroin or fentanyl or carfentanil, it's just
Yeah.
what your lungs do
Yeah.
when you've taken too much and you're overdosing.
So you're basically shutting down your brain, right? That we don't have to think about when to breathe, right? We just
Yeah.
breathe. We're not thinking about that. And this takes all of that away. That ability of our smooth muscle versus, to stop and us not have to think about it. So it shuts everything down.
Yeah, I spoke to a gentleman here on Kauai who had overdosed on fentanyl. I'm gonna get him on the show. He's definitely open to sharing. I'm not going to say any names right now, but I think many of you on the show or watching may know who it is. But he had suffered a fentanyl overdose. It wasn't a fentanyl by choice. It was one of those that he didn't know. And thank God, someone in that group had Narcan, saved his life.
Yeah.
And just a few months later, I believe he said 3 months later, he lost his brother to a fentanyl overdose where no one was around. He was alone and there was no Narcan and he lost his life. And it's a very sad story, but the, 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 the message is that Narcan works. Narcan is what you need to save a life. And I just hope that we can make Narcan available. Our good friend Kella from the Big Island said at the pharmacy at CVS is like $30 a box. That's two doses, and you know, I mean, not everyone can afford $30 to have that in the home, and I'm hoping that at some point we'll be able to provide this for free to anyone who wants it. How does Malama Pono's program works? I mean, I'm assuming you don't have an infinite number of Narcan boxes, but how does Malama Pono distribute the Narcan boxes?
Yeah, unfortunately, it's not infinite, and right now, so the
It's in short
supply,
supply.
yeah, it's in short supply. But we work with Hawaii Health and Harm Reduction Center on Oahu, and they are able to give us multiple boxes. So I think last year alone, we did about 300. We trained about 300 plus people, and almost every individual took two boxes with them. So that's four Narcans. So we had a ton. We thought we'd be okay for a while, but it's we're really
Dwindling.
happy with the community turnout. We're really happy with people who are interested and want Narcan for themselves and their family. But we are working on getting more as soon as possible.
And we
Do
do
you
trainings all over the island. We've done, like, we went to Honolulu and did it out at the beach, under
In the
a
pavilion.
pavilion, and did it because community members that were at another training that we were doing saw us and were like, "Could you come and do it in our community?" And we're like, "Of course." We've gone, like you said, Mel, to KPD. We came to you folks at the prosecutor's office. We did the mayor's office. We've done private businesses. We do other organizations that are nonprofits. We train anybody.
Yeah, and of course those that are exchanging needles.
Yes.
They want it for themselves and their friends when they're in the community. We've heard that it saved several lives.
Well, it's amazing. I hear the stories from the cops that get called and upon their arrival found that the Narcan was available and did save the life before the police officers got there. So we know it works. We know it
Yes.
works. So I would encourage everyone, have one. Have one in your purse, have one in your car, have one available. And are you folks? Do you folks have a supply for the public here in Kauai right now, or
Yeah,
are you waiting for? You do?
we do have some. Yep,
Yes.
we have some. So it's first come, first served.
Yep.
Okay, perfect.
And
So you guys all know, right? Go check it out. I got. Can you guys see the screen?
yes.
Okay, perfect. I'm going to be throwing on some questions that's popping up. Um, Kiala is asking, does methadone help fentanyl use? We have methadone clinics on the Big Island for heroin users.
Yes, I would think that I'm not a physician. We're not physicians, but methadone is a treatment replacement drug, and it's an amazing drug. It's also used outside of that for people with chronic pain, and it's a like I said, it's an oldie but goodie, but it treats a narcotic replacement. So yes, fentanyl is a narcotic, so it would be able to be used for that.
All right, one more. I hope you guys don't mind the
Not at all.
shotgun blast.
Hi,
How
Laurel.
would Laurel is asking, how would one know if someone is overdosing and needs Narcan? Do their pupils change? How can one tell if someone's
We brought
ODing?
our handy dandy notebooks.
And
All right.
and in addition to that, just a follow up to that question, what happens if you give someone Narcan who's not suffering from a fentanyl overdose? Let's say they
Nothing.
ha- okay, okay,
Right, and that's what we really try to promote here and have people understand is that overdosing looks very similar across drugs, right? So someone who's overdosing off methamphetamines at a certain point will look very similar to someone who's overdosing off an opioid. So um, always err on the side of caution and give it to them because it will not do anything if they are not overdosing off opiates. Um, there are no, some people, I guess, the small headache is the
Yeah.
only thing. We know other people that actually do this training that will
Do it to
put
themselves.
Narcan up their own nose, which we will not do.
We're not
But
gonna waste any
just to
doses.
show, yeah, just to show that it's not going to do anything unless you're overdosing off of opioids. As far as what an opioid overdose looks like, um, there's usually a few things, okay, and these are kind of hard to identify if you see someone, but just generally, deep snoring or gurgling, call it a death rattle or wheezing sound. Blue skin tinge, usually lips and fingertips show first. Um, Pale, clammy skin, heavy nod, will not respond to stimulation. That's a big one. Okay, when we do these trainings, we have levels of stimulation because someone who is high off opiates looks like they're overdosing to a regular person. I don't know if you've seen anyone out there seen anyone who's overdosed or who's just high off opiates, and they might look like they're sleeping and there's a needle sticking out of their arm, but they are not overdosing. Um, so it's really important to do the different levels of stimulation so you're not catching someone off guard, giving them, because when you Narcan them, you are essentially throwing them straight into withdrawal. And that is everything that they've been trying to avoid. So that's that's usually like our checks and balances on how we identify if someone is really overdosing.
So pupils, Laurel, you probably wouldn't see a change in because their eyes would be closed. But if you did look at their pupils, they would more than likely be pinned. Um, but it, we wouldn't suggest having. That's not one of the things that we would say to look at immediately to indicate whether or not somebody is overdosing on fentanyl or an opiate in general.
yeah. We I know in the department we were taught the different levels of stimulation, and the sternum rub or the chest, rubbing the knuckles on the chest. That works really well on people that are drunk. They wake up, they
Works on
wake up. Yeah, yeah.
It's a good one.
Um,
They teach us that really early on.
yeah, that thing works, but does it work? Would it work on? It didn't appear that it was working on that officer, and will that even work on someone that's overdosing on fentanyl, or
Right.
is it just is everything shut down so much that they cannot even feel or they cannot respond to the sternum rub, the chest the chest rub?
Exactly. Exactly. When they don't respond, that's when you know that they're overdosing off of something or something's not right, and that's when you want to give them the Narcan. If they are responding to the sternum rub, then they're most likely really high.
And I know that's going to sound crazy, but in the trainings that we do, and this is just around the harm reduction model in general, when before we Narcan somebody, we don't just go up and do it, right? There are steps that we follow to check with somebody. I know it sounds silly to some people, but it's the way that we do it. I mean, we Annie, are you okay if you've ever done CPR, right? If you've done CPR training, that's what we do. Are you okay? No answer. And then, hey, are you okay? I think you may be overdosing. I think you're overdosing on a narcotic. You don't even have to say fentanyl because it's synonymous, kind of, if you think about it. Um, and they don't respond, hey, Annie, I'm going to Narcan you. I think you're overdosing on a narcotic. And if they are not overdosing, they will respond. We've seen people that are full head nodded out, and I'm sure people have seen the head nod that people, can do, where they just kind of
Hmm.
bounce in and out, right? That will perk up the second you say, I'm going to fentanyl. or fentanyl. I'm sorry, I'm going to Narcan you. So they will pop up and be like, no, 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 no. And Charles has a great way to explain um, his 3 M's of.
Yeah, so I went to a conference, and this lady was actually addicted to alcohol for a long time, and she said, um, and it's a beautiful way to describe it. First, it's magic, then it's maintenance, then it's misery. And honestly, at that point, if someone's using every day, it gets up to a $200 or $300 a day habit. Um, all they're doing is trying to maintain. They're not really getting that high anymore. Um, so it's just you spend that much money, your whole day revolves around getting it. You finally feel okay, and that's a term that if anyone's worked around people who are addicted to opioids, they'll ask, "Are you well today?" And that's really not like, oh, are things going well? Are you not sick? It's like, have you had enough drugs that you feel okay today? And when you give them Narcan, you are ripping away every opioid in their body, and they do. That's everything they've been trying to avoid. So
They'll respond.
they'll most likely respond.
And if they don't, then you know to use Narcan.
And I think that's the part of addiction that most people don't really understand, that it's a battle, right? Every day. It's a battle to get high and to stay high. And like you said, as the tolerance level increases, it's harder and harder for them to get that euphoric feeling. And in fact, many of them never get it after a while because it's hard to get that much drugs. So they're battling just to be
Get sick.
in there. Yeah, I mean it's and that's, I think, a lot of people don't understand that. And yeah, it's sad, but it's again educating our youth, so and everyone else, that they understand what this addiction is. um, you mentioned the training for those, and there was a question. Let me see if I can pop it up here. uh, would you ever, this is Laurel again, would you ever give a second dose? Seems to be a popular topic on TV shows lately, so just wondering if what I've seen has any truth to it. We saw the training officer give his trainee, I think he got multiple doses, including while he was in the ambulance. So, is a second dose, if they're not responding, does that do you continue to give them more Narcan?
Most definitely. Mainly because it's not harmful to have more, right? That's one. The second thing is when you give that second dose, you may not realize it, but you want to put it in the other nostril. And it's because one nostril might be clogged. So they didn't actually get the Narcan or receive the Narcan in the process. We have heard stories of KPD here, I think I can say it, getting 5 or 6 shots of Narcan, and that actually pulled them out um, actually pulled them out of an overdose. But it took that many. It took 5 or 6.
So, for someone that is interested in picking up a box of Narcan from Malama Pono, I'm assuming that when they come down there, I know that online there's, you click a link and it pretty much gives you the training there. But if they come over to Malama Pono here on Kauai, will they get the training from you folks before they leave with the Narcan?
Absolutely.
Yes.
Absolutely.
And
Are happy.
what does the training entail? I mean, how long is the training? And kind of,
Most of
I've been through it, but what
Yeah.
can they expect?
this.
Yeah, I mean, if we're doing like a group setting, it might take a little longer. We do 30, 45 minutes. The basic gist of it and how to use it, we can probably cover in 20 or 25. We can do it even shorter than that because people who are coming in for needle exchange usually want to run out the door as soon as possible. So we just give them really the basics. And the key with that is because it's not addictive, because it's not going to harm you, we can do that. If that wasn't the case, it'd be much different. But we can do it relatively quickly. And if there's a lot of people, we prefer to do it in a group setting because that's a lot of talk.
So most of the training, a lot of the training we've done already tonight. Like we've literally, this is probably a few more pages and we would be
Mhm.
done. And basically showing, pulling them out and showing people what they look like and exactly what to do with it. So, and we do have some we can show And it is just like what you saw on the video that you posted.
Pretty simple stuff. Open up the pack and put them in. It's like a nasal spray. It goes right in the nostril, and you shoot them in the nostril. If they don't respond, you take the second one and you put them in the other nostril. And um,
That's right.
I it 5 or 6 doses. I've heard a few stories, not many, but it seems like the first dose usually works. I've heard a couple of stories where they had to do a second dose, but this doggone thing is pretty damn effective, and it's something that we can save lives, and
Yes.
we really gotta work. So we gotta work on getting this in the hands of people and do our best to get them to organizations like yours. People have a it's
For
just
free.
human nature. Then when it's free, you're gonna take more than you need. But I think getting everybody a box in everyone's home, in everyone's medicine cabinet, I think is important. And I appreciate what you guys are doing with the needle exchange program with their participants, with your participants, because we know that there's Narcan out there on the street, and that's typically is where it's going to happen in that segment of the community, that demographic of people that are using drugs in social settings, and it's good to know that they have Narcan just in case. Wow.
And we definitely get feedback. Like Charles said, the people that say they use what we gave them and it saved somebody. I mean, and we go as far as to encourage people to use in twos. One person will do the drug while the other person waits to see if that person's okay. And if they're not okay, they have Narcan and they can call 911. And
Yeah.
that's a big thing that we want them to stay with them for at least one after they administer the Narcan. So it's, it, it can not only it can, it does save lives. It's educate anybody that wants to hear about it. We come to you, and you don't have to come to us. We go to people all the time.
Hmm.
All right. Well, we're coming up to the end of the hour. I do want to give you guys an opportunity to let our viewers know, especially those here on Kauai, how they can get in touch with Malama Pono, not just for Narcan, but if you have any of the services, need of any of the services that Malama Pono provides, or if you know of someone, how can they reach you folks?
So our office, what the best way to explain it is Old Kauai Athletic Club. And if you've really been here a long time, we're in the old locker room part. We have a brand new clinic that we built, uh, and our location on the west side, like we said. But you can 4370 Kukui Grove Street. We're in Suite 114 and 15. 114 is where you'll stop and see the sign for the door to come on in. You can give us a call 246-9577. Our website is mphskauai.org. Um, you can reach out to Charles or I, Misty at mphskauai.org, or Charles at mphskauai.org. And I'll throw up our information link in the comments a little bit
Oh,
later for you.
perfect. And the organization on Oahu that is offering the free Narcan, what was their website again? I'm sorry.
It's HHH, so triple HRC.org. And it's Hawaii
H
Health
H
Harm
H.
Reduction Center. Yeah. They're amazing agency on Oahu, and they are our sister agency and have been for many moons,
Hmm.
even from the very beginning when Malama Pono only did work with people with HIV/AIDS, and they do the same work, similar work. We don't all do the exact same thing, but they piloted this. Actually, the Chow Project piloted this initially, and then um, took it in house. Heather Lusk is their me, and she's amazing. And she used to run the Chow program, and now she runs Triple HRC and does a great job. And so she piloted that and brought it to Hawaii.
Awesome. Well, hhhrc.org, folks. You can go online tonight and order it, or you can visit Malama Pono again. Misty will put up the link information and contact information in the comments, so make sure you guys take advantage. Really strongly encourage all of you to go ahead and get your free Narcan. And the most important thing is having the discussion with your family, with your kids. Uh,
Yes.
I think it's so vital And I understand some parents are hesitant to speak about drugs or sex with their kids, but that's kind of where it starts, folks. It
Yeah,
starts with us educating and informing our kids to make sure they understand, because this is the bottom line. They're going to hear about it.
you
They're
know
going to
it.
hear about it either from you
Or the
and
internet.
learn it, or they're gonna get it from the social media, from the internet, or from a misinformed
Friends.
friend. Yeah, and so these resources are out there, guys. Malama Pono, Health Services Kauai. Any closing comments, Misty or Mr.
We'll
Wrestler?
do a selfless plug for us for our
Please, please,
Kauai
please.
Savings fundraiser, which you will get an email or actually a text from me about anyway to ask you to come as one of our distinguished guests. We were just talking about you tonight at our board meeting, um, December 17th. It's our very first fundraiser since the pandemic hit. We've not been able to have it. It's Gleising's Christmas. It's a show that is produced and directed by Jason Blake, amazing human on this island. We love him and Philip both. Philip just wrote a book, by the way, The Peace Alphabet. Gonna throw that out there too. It's amazing. But please come. $30. Tickets are $30 in advance. $35 at the door. I think we only have 2 tables left, preferred tables anyway. Those are $350 for a table of 10, and then we have some other tables that are $300 that are a little bit further back. But it's an amazing show, and we a lot of times call it a friend raiser, and like I said, it's the first time we've gotten to bring everybody together since the pandemic. So we're really excited about it. And we're excited to see everybody, and we're excited to see what Jason has in store for us. So that's my selfless plug for Malama Pono tonight. Outside of please, we do our very best to meet people where they're at. When you hear us say, there's no judgment, and we don't care what somebody's been through, or we don't care if you have shoes on. We don't care if you're. We just want to love on people and to give them the best service possible from what our service menu is. So we welcome anybody.
Charles.
I just want to say thank you, Mel. Thank you for what you're doing here and allowing us to
Yes.
get our message across. We really appreciate it.
You entertained us a lot during the pandemic.
Well, my focus is, I know we lost a lot of viewers because everyone was so focused on COVID. And I think there was a time that we needed to put all our energy in protecting people from COVID. And we're at a point now where this COVID's still here. And don't get me wrong, I'm not minimizing the impacts of COVID. I think we still got to be cognizant that this pandemic is still going on, and it's still dangerous. But the other side of that is we got to also deal with the other issues that we're facing with today. And that's what the whole focus of this show was, to just inform and educate, and that's what we're going to continue to do, with organizations like yourself. And we appreciate you guys so much for taking the time. I know 7 o'clock is when you should be home with your families and doing what you like to do. So we appreciate you guys being here. And the fundraiser again was on December 16th.
17th.
Oh, 17th. Okay, that's a Saturday.
Yeah, it's at Kilohana. So we rent
Okay.
out all of Kilohana. And I do want to add that we do provide transgender services too. So we do provide hormone replacement therapy as a part of our women's clinic. And sometimes people don't realize that falls under that category of things, but we are huge supporters of our LGBTQ plus community. And we provide that service for transgender people, and they're invited here to come receive our services. We have amazing providers here. I don't know if anybody knows Dr. Carol Fujioshi. I call her the famous OBGYN on the island, because when we go to dinner, we always get free food because she's always delivered somebody's baby. So we get dessert. I'm like, I can take you everywhere because we always get free dessert. She sees patients here too, as does Brandy Bartholomew, who's our nurse practitioner on staff, and we're happy to help anyone.
Well, thank you for all that you folks do. Really, I mean, the community, for serving the community. Also, send me a flyer for your friend raiser, and I will definitely post it up. Get me the email. I may have actually got that email today, if I'm not mistaken. So
I think you did.
I got to check with my calendar girl, my lovely wife Patsy, to make sure we're open, and we will definitely try to be there. But from the village, from our village here. Thank you so much,
Thank
Charles,
you. Really
Busy,
appreciate it.
and we will be in touch and probably have you back on at some point to share with us some of the other services that you provide. So,
Great.
Love to.
Love to. Thank you.
all
Thanks
right.
for having us. We appreciate it.
Thank you. You guys have a wonderful evening to the village. You guys, we won't be on tomorrow night, but we will be back next week. We love you guys. God bless. Have a safe weekend.